going to hear from some incredible panelists advancing important work around housing and homelessness systems in Rhode Island. So Kimberly Simmons is the Executive Director for the Rhode Island Coalition to End Homelessness. Michelle Brophy is the Associate Director for the Rhode Island Department of Behavioral Healthcare, Developmental Disabilities and Hospitals, also known as BHDDH, and is a board member for the Rhode Island Continuum of Care. Paula McFarland is the Executive Director of the Pawtucket Housing Authority, and Jennifer Hawkins is the President and CEO of One Neighborhood Builders and serves as a board member for the Rhode Island Continuum of Care. And all of today's panelists serve on the state's Housing Resources Commission, which supports the development of state housing planning, policy, and programs. Thank you all so much for joining us today. So to give us some grounding, the number of Rhode Islanders experiencing homelessness has grown significantly over the past few years. From 2019 to 2023, the number of people who were unsheltered, meaning living outside, quadrupled, and the number of people experiencing homelessness overall continues to increase. Housing and homelessness systems ideally work together to quickly house people experiencing homelessness and ensure that these individuals can stay stably housed. In Rhode Island, the state government, municipalities, and nonprofit service providers work on their own and together on these issues. Today, we'll explore how these systems currently operate, as well as discuss barriers and opportunities for more collaboration to make stable housing more accessible to people experiencing homelessness. With this background in mind, I'd like to turn to our panelists. Kimberly, could you give us some insights on why we're seeing so many more people experiencing homelessness over the past few years? All right, Kimberly, you're muted.
My apologies. Okay. No, the primary driver, I think, is that there's such a huge gap between incomes and rent. And that's nationally, but definitely in Rhode Island as well. And, you know, we've had affordable housing for low income, very low income, shrink, and unwilling landlords to participate in housing first in working with other primary service providers. And I think also wages have not kept up nearly as what they need to for individuals and families to be able to afford housing. And the interest rates are soaring. There's no concrete incentives, you know, for those who are private landlords to be working with us. I think folks are trying to do that better now and get people more knowledgeable and aware. But right now, there's such a huge chasm between wages, what people can afford for the housing that's available. And we also need more legislative support. I think that's dwindled over time, and the support in the amount of money that's been given out at the government level has gone down. I mean, there's been a myriad of things. And then, of course, during COVID, everything was exacerbated. And I think that we've sort of fallen, you know, down in our ability to take care of those who've been chronically homeless as a result of the COVID epidemic.
Thank you so much for that context, Kim. That's really helpful. And could you talk a bit about how that data, for example, that I just cited on who is experiencing homelessness is collected and what is done with that information?
You just went out, Allie. I'm sorry. I didn't hear your question.
All good. So I said, could you please give us some context on how that data on who is experiencing homelessness is collected and what's done with that information?
Yes, and across the state of Rhode Island, the coalition collects the data for HMIS, which housing is used for a very long time across the nation. We are the call center that is used for people to contact our call center helpline. There they get into a queue based on what things they qualify for, if they're family, if they're gender, you know, if they want to be in congregate living, there's a space in which they get all that information, and then we try to get them into shelter. Unfortunately, shelter is not always available, or it's not always what is fitting for the clients or those that you're trying to help. So I think that's been an issue. But what we're trying to do across the state is to work with more than just the immediate homelessness service providers, but with a lot of other organizations that we can help retrofit, if you will, the needs of their needs for collecting data, like the domestic violence or the youth, and what is exactly fitted for just homelessness service providers.
Got it. Thank you so much for that context. So the point in time count that the coalition and other providers conduct feeds into HMIS. And as you talked about, there's some different populations in there that you want to make sure to capture. So turning to Michelle, so there are so many groups working on housing people who are experiencing homelessness. You and Jen, along with several other people, are on the Continuum of Care or COC board, and you were chair of the COC board for 10 years. You also do a lot beyond that. So could you please explain a bit about your role in these systems and also what COC is and what role it plays in homelessness and housing?
Sure. And just one quick correction. I'm not on the board anymore. I was for 10 years. I am part of membership, and I actually think you should all join it. It's great. There are committees throughout the continuum of care that work on specific issues, and anyone who's a member can join. If you're not a member, you can join committees, but it's just a great way to become active and learn about the continuum of care. And just a shout out to Peter Asen, who was the chair of the COC right after me and is now the director of the Providence HUD office. So the COC HUD requires geographic areas to have a continuum of care. Rhode Island just has one continuum of care. Many states have several. So the continuum of care promotes community planning and the strategic use of resources to address homelessness, to improve coordination and integration of mainstream resources and other programs that target people who are experiencing homelessness or at risk of homelessness. It improves data collection and performance measurements that allows communities to really tailor their efforts and address the challenges in communities. So for me, being an associate director for vulnerable populations at BHDDH, my role here is to kind of work collaboratively with the continuum of care. I really feel like that's a great vehicle for me to get a lot of the work done that I need to do here. We have various, I'll say, feeders of the system, because we have a lack of housing and we have a lack of pathways to supportive housing. I spend a lot of my time working with Rhode Island Housing, the Department of Housing, the Housing Network, the public housing authorities. Paula and I work together all the time to see how we can increase access for the population. So at BHDDH, that's people with behavioral health issues or developmental disabilities. So trying to create access to affordable units, whether that means partnering with agencies to apply for mainstream vouchers for people with disabilities, whether it means, again, partnering with Rhode Island Housing for 811 units, or really working alongside our state agencies like EOHHS and Medicaid to create support such as home stabilization services that will allow people to have access to housing retention services. So when we do partner with an organization that either manages housing or develops housing, individuals are provided with the services they need. And it's a work in progress. I mean, I think we've been working on this stuff. I know I have for almost 30 years now. So I'm interested to see, where we can make improvements all the time, and we're constantly making tweaks to see how we can change the system for the better.
Thanks so much, Michelle. That's so helpful. Paula, I'd like to turn to you. What are you seeing in Pawtucket in terms of housing and security and homelessness? And how is the Housing Authority working currently to house people experiencing homelessness?
Well, thanks, Ally, for asking that question and for all the panelists here. Michelle's been doing this work for a long time, and I know Kimberly's been doing it and Jen's been doing it on the development side. For the public housing side, I've been in the housing realm for a long time as well, and this is probably the largest crisis I've ever seen in the housing industry for us, and especially the most vulnerable populations. My biggest concern is, we run a COC program, which is unique to most public housing authorities. And we also run the Emergency Solutions Grant, which for emergency housing as well, on behalf of the city of Pawtucket. And we also have a shelter that we own, which was not something part of our mission, but we felt the need that we had to intervene and purchase a building at 1139 Main Street, which most people know of that particular location. We are not the provider of services. It's Open Doors provides those services on our behalf. But we own the building, and currently right now it's in rehabilitation with a grant from the Department of Housing. So we received funding for that. But what we're seeing with housing insecurity is the difficulty that now our most vulnerable population, our most lower income population, which is our homeless, can't access the public housing realm because of the fact that many people now are accessing it and staying much longer in our housing, which means we have gaps now and we can't, move people as quickly as possible as we were before. So that's become a challenge on our public housing side. But then on our housing voucher side, which we just received this week from HUD, our fair market rents are going down. I can't understand that when we're in a housing crisis and everything is going up, but we're being told that our fair market rents are going down. That means that I can only put so many vouchers out for opportunities for people to seek housing. And if they can't find that housing, then those vouchers have to be turned back in. And also we can only allocate so many out of our allocation, which makes it very difficult for people to access, all of the vouchers that we would want to put out there because we only have so much money to allocate through HUD. So we have to hold back on some of those vouchers because we just don't have the means. And then the landlords who are also asking us for increases consistently, sometimes twice a year. We're trying to push back on that, but we may have to increase our capacity and go above that to like 110% to us to try to assist people. So that really puts a gap in the housing opportunity, especially for our homeless population. But we try very hard. One of the things we do is we have in our COC and the ESG program, we try to issue vouchers to get permanent housing. That is ultimately what our case managers are doing to support. So we're trying to align that, not only aligning all their needs, but also aligning the fact that we want to make sure that they get permanent housing as quickly as possible, and so that we can move them to the next realm. I will say, though, we also, on behalf of the city, mental health for us has been a real huge component. And as we know, everyone is talking about the mental health issue. The city has stepped up and given us $200,000 to address for us and our families here in the city of Pawtucket to address mental health needs. And I want to thank them, the city, for doing that. That's really, they championed the work that we do. They've helped us with purchasing 1139 Main Street. And now when we talk to them about the mental health issues that we're facing for many of our residents since COVID happened, we're still seeing the onset of that has not continued to go away. If anything, it's worsened. And I also want to just add briefly that I also see the next crisis for us being healthcare. Access to healthcare is becoming more and more difficult for our families, and I only think that that's only around the corner before we start hearing about our families because they're more vulnerable. The lack of transportation, the lack of ability to get there, the lack of computer technology, broadband, digital broadband being available. Access to healthcare will be the next thing that Rhode Islanders will be talking about. I'm sure they'll be talking about it come January, because it just seems to me that it's becoming even, we've been talking for the last couple of years about mental health. I'm now talking about healthcare and families not having access to just healthcare. So we're trying our best here, and I'll continue to advocate as much as I can to ask our city, our partners that we work with, all of the mental health advocates that we have, the domestic violence advocates, and of course, the coalition to continue, and our state partners to continue working with us to bring as many services, social services that we can to our most vulnerable.
Thank you so much for all that context, Paul. And I think what you're touching on too speaks to, like, we can't just talk about housing in a vacuum. People need more, people need so many things. And so I appreciate you raising that. So now turning to Jen. So Jen, you're on the COC board, and One Neighborhood Builders has a COC contract. Can you talk a bit about, and Paula mentioned also that Pawtucket Housing Authority has a COC contract. Can you talk a bit about what having a COC contract means and what that looks like currently for One Neighborhood Builders? As well as why it was important for One Neighborhood Builders to prioritize housing individuals with the lowest incomes experiencing homelessness.
Sure, thank you. It's great to see everyone this morning. Thank you for joining us. So, I feel very strongly that nonprofit developers and owners have a responsibility to prioritize persons who have experienced homelessness and who have the greatest kind of vulnerabilities and acuities. That if we aren't doing that, how can we possibly expect market rate landlords to do that? So I feel like we should be first in line. And so as a CDC, I just feel like that's part and parcel of my mission. I would say that from a system standpoint, there is nothing that incentivizes me to do that. And I think that is a great challenge in the state of Rhode Island. So, there are not extra, I might get extra points on the QAP for doing permanent supportive housing. I would argue it should be a threshold criteria. If you're going to get a 9% allocation, you have to be doing permanent supportive housing. I would suggest that there's capital subsidies that are specifically set aside for this, so we're not competing with everybody else. There is really, at a systems level, no concerted and coordinated effort outside of continuum of care resources to produce housing for those who are the most extremely low income, who experience homelessness and have the greatest health acuities. Other states are doing it. Rhode Island's not doing it. So beyond, like I said, that kind of fundamental challenge, I think that there are opportunities, and I think One Neighborhood Builders has been able to leverage our health equity zone to pay for resident service coordinators, because our properties generally we can't include that as an operating expense really on our budgets. To pay for the services that are needed to sort of provide care coordination for our residents. We have a team of 5 full-time resident service coordinators. Most organizations, nonprofit developers, owners cannot afford anything like that. And the reason why we have been able to do it is because of support from the Department of Health. I'm quite concerned, frankly, about reduction of Department of Health resources. And we're thinking a lot around how do we ensure that we can continue to provide those really critical resident service coordinators. And I think there's opportunities around billing Medicaid to provide, home stabilization services. But I think that the topic that Paula raised around kind of this, the healthcare crisis, there's a behavioral health and opioid crisis that persists. Unfortunately, we've had 3 individuals who have overdosed and died tragically in our apartments in the last year. It's something that requires skilled clinicians, skilled substance use specialists to be able to interact with these residents. And our resident service coordinators are phenomenal, but they are not skilled clinicians. We are not a federally qualified health center. We're not a community mental health center. We are a nonprofit developer and owner of affordable housing and doing the very best we can. But there is, I think, a lack of adequate services in the state. And when you go to organizations who provide these services, they're often saying like, we don't have the capacity to do what we do now. We can't, I'm sorry, we'd love to be able to work with you, but we can't partner with you. We just don't have enough staff. We're stretched thin. So I think that's just a really big challenge. And the last kind of and I don't mean to be a Debbie Downer, but I'm just laying it out here, of a systems level, is that it's really in many instances, all of the responsibility and onus is placed on the developer. So when they want to develop permanent supportive housing, we want to set aside units in our next development for persons who are on the coordinated entry. But then it's on us to find the rental subsidy partner, bring it all together. There's no one at the state level who's saying, I'm going to make that happen for you. I'm going to make sure all of these services and subsidies are woven together, so you don't have to hustle to make that happen. And I think that at a systems level, if that was occurring, I think a lot more of my colleagues would raise their hand and say, me too, I want to do it too. But when it's harder, and there's no real extra credit you get for doing it, it's really hard to convince my colleagues to stand up and do permanent supportive housing.
Thank you so much, Jen. Jen, you've laid out kind of your vision for the future. So I really appreciate your laying that out so clearly. So Kim, you're also thinking about kind of opportunities for incentivizing housing for people experiencing homelessness. What do you see as potential opportunities for collaboration to get people experiencing homelessness more stably housed?
Sorry. I think collaboration in and of itself is a huge evidence-based solution to permanent housing. I think, we as the coalition run the HMIS and CES system, which is, to fortify and to get accurate data so that we can then inform all the public and the private entities on what needs to be happening. I think there's an opportunity for us to stop doing so much data siloing, where we have certain data that's collected certain times of certain populations. I think the coalition really should be, and be honest, use its ability to partner and bring people together to do that, so that we can make sure that our software functionality, that things are being answered, that our service providers really want answered and addressed. It will also give us political and public will and understanding and power to come together when it's legislative opportunities. There's real chance for us to do more collaboration and partnerships across populations that don't get served, which Jen was mentioning, and Paula as well. We're now collaborating with Lifespan, for example, just to be talking about what happens to individuals who come out of the ER and are dumped at the curb. We've heard many stories recently about that situation. So we've tried to bring different people to the table to understand the problem and then be able to help us with solutions.
Thank you so much for that, Kimberly. And so now, Michelle, I want to ask you, we've heard about data, and there's a lot of data that is already out there. And so in a lot of policy conversations, we hear often a lot that we need specific data before moving forward with policy decisions, which is certainly important for evidence-based decision-making and policies, but can also sometimes stymie progress if we don't have the exact data. Can you talk about how this quest for data plays out in the homelessness and housing space, and any tensions you've been seeing around that?
Sure. And I laugh whenever somebody asks me a question about data, because I am constantly saying in public that I'm allergic to data. And I think I've said a few times at the HRC that our quest for data leads to an action in Rhode Island. So funny that this question's headed my way. So I do think right now in our systems, we don't collect, I'll speak for myself, in our system at BHDDH, we're not collecting the type of data that we need for the individuals we serve to actually be proactive. So we're constantly being reactive. And I think the same could be said in any state department. I do feel like, the homeless management information system, if we could do more data sharing, and I know there's a data sharing agreement between the ecosystem, but if we could start looking at who is, you know, in the BHCDH system and in the HMIS system, who is in the DCYF system, the Department of Human Service system, the Department of Correction system. We have so much information that we can gather to actually see, like, what are some circumstances that are leading to homelessness, and see if we could potentially fix them systemically, so we can avoid people falling into a homeless system. I also think that we need to do a better job letting the state know where people who are experiencing homelessness are coming from, so we can create a cost benefits analysis, because we do know, we've proven time and time again, it's been proven at the national level, that it actually costs more to keep people cycling through homelessness than it actually does to provide them a rental subsidy and services. So we know that's true. So how do we kind of use our data to do exactly what Jen was talking about, and having, you know, state departments put into their budget funds for capital, funds for operating, funds, you know, for the services, so we can tie this all together and create pathways for individuals that stops them from having to go through a homeless system in order to get supportive housing. That shouldn't be like that. That's the least efficient and least effective way to actually end up in supportive housing. And it's really traumatizing. So I think there's a lot of data matching that we could do, and especially in the health and human service agencies kind of come together and show what the real cost is to our system for doing nothing.
Thank you so much for that. And I'm actually not hearing an allergy to data. I'm hearing we need to use that how we're using the information we already have to then be more proactive, so that people don't have to go through homelessness to get stably housed.
Sure.
Kimberly, do you look like you want to jump in?
Yeah, I totally agree. And I'm just thinking that when I first came to the coalition not too long ago, I was saying, from my observation and research, that we haven't really included or reflected what is absolutely going on for homelessness in the data system that we currently have. We couldn't possibly be, because we have, you know, the populations like elder care, disabilities, youth that we dabble a little bit in, LGBTQ. There's so many subsets of populations that we don't necessarily get. And for domestic violence, you know, having been someone who ran a domestic violence organization, I know they have very peculiar, very specific things that they need. But that just means that the COC, the coalition, and whomever is going to be working with us on HMIS, it's the state's data. We need to figure out ways to capture it. So if HUD needs to look at the ways they set up their regulations, and it's not applicable, or at least able to be applied to other populations, that needs to have a discussion. We need to have discussions about better ways to accommodate that data connection and be available. And I think that's a big change that would help in the system that I'm saying the coalition is invested in making sure happens.
Awesome. Thank you so much for that insight, Kimberly. That's really helpful. So Paula, for this is the last question before we'll open it up to Q&A. So get your questions ready if you're feeling. So I'll give instructions on how we'll do the Q&A, but I wanted to give that so you can start percolating. Paula, so we've heard a lot about like barriers and potential solutions, but kind of what's stymieing progress. What are you thinking about in terms of kind of accessing kind of opportunities for collaboration and kind of transforming those barriers into opportunities around to advance solutions to homelessness in Pawtucket?
So I am all about collaboration because I'm here to do housing and I can't make sure that our agency is doing it all. So I want to collaborate. That's why I asked the city to help us. We're not going to do the mental health work. We're going to work with our partners here in the city to do that work. But we need to get people into our organizations. We have a small wellness center so that we work with Gateway, we work with other agencies, Blackstone Advocacy for our domestic violence. But we just see, I think all of the panelists here today talked about it. We're seeing, we see overdose of due to drug activity. We lose many residents due to that. So we know that needs to be addressed in our housing, but we need partnerships to do that. And then we also need to talk about the cycle of people becoming homeless again because we don't have the resources. And we've invested a lot in the resources, even though we don't get them at a federal level or a state level. I felt that we had to bring that capacity here to make sure that we take care of the residents that are here. The last thing I want our residents or our homeless population is to be recycled in and out of our system, meaning they move in, they move back out again, or they're left back out on the street again because they can't adhere to the norms of what's going on in our society. But we have such a great opportunity in the state. We're such a small state. We could play such a pivotal role in showing how housing could be integrated so that our residents here in the state get permanent supportive housing. But we also need to address the fact that we're not addressing the very lowest income population, which is the homeless population in our state, to get them housed, permanently housed with supportive services. And everybody has different access and has different needs, but we have so much great opportunity if we just actually did it. And I think Jen talked a lot about it. If we're going to create additional housing, let's make sure we have that supportive piece connected with it. So we're looking at pre-development right now. We're looking at some units that we may have available, but if we can't connect all of the pieces, it makes it very difficult for me to bring additional housing in space that I already have a lot of housing in and then not have any supportive services to address the needs of the residents there. And it's not just healthcare or mental health, it's also food insecurity and employment opportunities and transportation to get there and childcare for families and all of the other things that families need to have to be a healthy, a vibrant community, because that's what I see all of our housing as being communities and neighborhood communities. So I really think that we have great opportunity, but we have barriers to get there. And great panel here that I know we can all work together and hopefully be successful at some level.
Thank you all so much. This has been such an insightful discussion, and I hope everyone's writing down all the things to do next, because there were a lot of really helpful steps in there. So now we're going to be, for this final 8 minutes of our time together, we're going to be opening it up to Q&A. I'm just looking first at some questions in the chat. So when Paula was talking about fair market rent in Pawtucket decreasing, so Peter Asen, who's on from the Providence HUD office, said that Jen asked why that's happening, and Peter said that that's tricky. Rhode Island actually had the largest drop of any states, and most had increases, but we had large increases last year. And as Paula noted, since her PHA Public Housing Authority isn't already at 110% of fair market rent, they have room to increase payment standards still this year. Peter, I don't know if you want to expand on anything on that. Don't want to put you on the spot, but just thanks for that context.
The only thing, thank you. It's a long and complicated topic on its own, and there's a whole way that HUD calculates these, and I am wondering about if somehow the way they did it last year something was off or something like that, because I think there were increases of about 20% in Rhode Island last year, and obviously rents have been going up quite a bit. So I think that people thought at the time it seemed reasonable, but somehow they readjusted it, for the coming year, where there is that drop. So EHAs have the authority to set first of all, there is an ability to appeal that. And I don't know if any housing authorities in Rhode Island have sought to appeal that or not, but there is an ability to have that looked at again. The other thing is housing authorities have the ability to set their payment standards between 90% of that fair market rent rate and 110% of that rate. And so every year that they can kind of adjust based on that as well. And then the one other thing is that a housing authority can, in its, the big problem with a drop is that when you do the recertification the next year, you could end up in a situation where you either have to drop the rent, which could be really problematic, or if you even keep the same rent as the year before, the tenant could end up having to pay more. And so there is a way that a housing authority can have in its administrative plan, like a hold harmless provisions for when these kind of drops do happen, that they can make sure that the tenant doesn't have to pay anything more and that the landlord doesn't have to deal with a rent reduction. But again, it gets complex, as Paula pointed out. In some ways, that also takes up more of the housing authority's dollars too. So the whole thing is difficult for individual housing authorities to manage, to be sure. But I do think that Pawtucket, by not having kind of put themselves at the very highest that they could be in the past, is in a better situation maybe than some others to adjust when this kind of thing happens.
Thanks so much. And just for folks who maybe aren't as familiar with how fair market rent plays in, it's my understanding, and feel free anyone on the call to correct me if I'm wrong, is that what we're talking about with the fair market rent is that the Pawtucket Housing Authority is paying a landlord from HUD funds a certain percentage of the fair market rent, which is set by HUD. And so if there's a drop in that, what the Pawtucket Housing Authority is able to give, then there's a gap between what the rent the landlord is charging and what the housing authority is able to contribute. So leaving a gap for the tenant to pay. So Jen, I'm seeing your hand raised. Anyone else can, or if Jen, if you want to, I think you feel free to, and if anyone else wants to raise your hand, you can go to the React and then raise your hand, or you can come off mute.
Yeah, someone else has a burning question. I'd love to hear from them rather than myself speak. But if there wasn't a question, I was just going to take one moment to say that, ultimately Rhode Island is facing a massive supply crisis, right? And when you think about people experiencing homelessness, oftentimes in the public consciousness, we think about the unsheltered homeless, the people who have experienced severe mental health or behavioral health issues. But those individuals actually represent a very small minority of the persons who are, or the constellation of people who are experiencing poverty. And normally what you're able to do when you're triaging is that you're able to say, okay, you're going to get, housing problem solving services. And maybe with a little bit of support, you're able to avoid eviction to stay housing. Or you're able to get a rapid rehousing voucher and find a mainstream apartment. But the problem is that because we are in this supply deficit and there's really no vacancies, the ability to support people with housing problem solving or rapid rehousing becomes almost impossible. And so now what we're seeing, is just this massive escalation of people who are unsheltered in our shelter system. And so at the end of the day, it all comes down to we got to produce, in my opinion. But with the understanding that for that small subset of people who have severe mental health and behavioral health challenges, who are disabled, that you have to also provide the services in order to properly provide housing first. Housing first is housing, low barrier housing first, right? But it isn't housing only. And that I think is a really important distinction. Housing first is not housing only. It's just that we recognize that we can't make compliance to services a prerequisite for obtaining housing. That's my last soapbox comment for this morning.
All right, Michelle.
So I just wanted to add to that. I mean, when we talk about the lack of units in our system, we also need to think about the people who aren't just outside on the streets or in shelters, but the people who are on fixed incomes. Like the number of emails and texts I get about an individual who's an older Rhode Islander, who's on a very low income, and because there's a lack of units, landlords are doubling rents. That individual is someone who's going to be in your homeless system, momentarily because they can't afford to double their rent. They're on a fixed income. There's not more resources that they can bring to the table. So I completely just want to support Jen in the fact that, yes, we need to build housing and we need to make sure we're addressing in all the communities, zoning, land use, because, just knowing that it's taken some affordable housing projects 7 to 10 years from the day they actually get funding to the day they open the door because of all the different obstacles in their way. We really need to address that on the local level too, because we're not going to get out of this crisis until we have enough housing on the market.
Yeah, I'm just gonna jump in just quickly, and just say, it's not just, the population of being homeless. We have families, we have lots of families that are calling and very desperate emails that are received. And our senior population, that is the other spectrum that you just talked about. Our senior population, families calling me, begging for housing because their parent, their aunt, their cousin, who is elderly, who's lived in a house for 20 years in an apartment, paid rent for all that period of time, and now has to be out of the apartment within 30 days. So that is a very difficult, those are homeless that we're not speaking about instead of talking about our chronically homeless, but those families are, and also if they're working and their income is above housing for public housing, they really have no place to go. And because there's just the demand for housing and the opportunities for us to build it as quickly as we need are not there. So we're seeing that every day, and we're doing our best to try to help those families through a housing navigator. So I just wanted to add that too.
Thanks so much for raising that. So clearly there's a lot more to discuss beyond what this discussion time allows for. So we, as we're nearing 9:30, and I wanted to take this opportunity to thank our panelists for their time, insight, and expertise this morning. And I also want to thank all of you who took your time out of your Friday morning to join us. And I really appreciate the commentary now in the chat that's going on around other things that people are seeing. And so we hope that you'll consider joining us at a future Fresh Friday. We'll be back with our next Fresh Friday on October 11th. And if you're here today, you will receive an announcement about the next session. Please note, as you're exiting the Zoom meeting this morning, a brief survey about today's event will pop up in your browser. It'll ask for feedback about today's session, including on topics. And please take a minute